Dr. Ray with you today for your natural exam, meaning that we're going to use our senses, sight, sound, touch, to examine you today. I like to work my way right from the very get-go, right from the face here. And I'm just going to have a little feel all around your face. Just feeling for any areas of excess heat. I know I'm feeling a little extra warm here today. 'Tis the season with the sweaters are coming out and we're keeping ourselves nice and cozy and warm. But not feeling any fevers there. Your temperature feels quite good. Excellent. Alright. And in the same theme here, I'm just going to come a little closer, looking a little bit more specifically at your face, looking at the symmetry, and I don't mean that you are supposed to be perfectly symmetrical, nobody is, but just making sure that the muscle tone is the same on both sides. That there's no, facial drooping or lack of nerve control on one side versus the other. I'm just going to touch the corners of your eyes just to make sure that blink reflex. Perfect. It's feeling good. Just going to trace over your eyebrows, feeling along your jawline. I'm just going to feel a little bit underneath your jaw as well here. So we have some major lymph nodes. You can palpate for size and shape. All feels perfectly normal there. And I'm just going to get you to open and close your jaw while I'm feeling that joint, that TMJ. Opening and closing. Nice and slowly. Perfect. Everything felt very aligned. No discomfort. Excellent. I'll just get you to do a big smile for me so I can look at your pearly whites. Lovely. And again, let's get you to open your mouth so I can see you in as well. Excellent. Alright, coming to the side here, I'm just going to have an external look at your ears. On the outside, looking very normal. Any concerns with hearing loss on this side? I haven't noticed anything. Any buzzing or humming? Okay, very good. No changes. No changes. I'm going to do the same thing right over here on your right side. Looking at the shape of that ear. Perfect. And same question. Any concerns about loss of hearing on the left side? None. Any buzzes, hums, tinnitus? All is stable. Alright, I'm just going to be palpating down your head, through your hair. Let me know if there's anything uncomfortable. Just doing a little scalp check as we go. I'm going to be putting very light pressure just on the back of your head. Let me know if there's any discomfort when I do this, okay? A little pressure right now, and release. And pressure here as well, and release. And just on the sides as well. I feel okay? Alright, perfect. Lovely. And my next thing, it might seem out of order, interestingly, but I'd like to see your hands just to check your pulse quality and rate, and also just looking at your circulation by looking at those fingertips. Alright, so if you don't mind holding out your hands here for me. That's perfect. I'm going to examine them front and back here. Just going to squeeze those fingertips. Get a nice capillary refill time where they go nice and pink very quickly. Not any concerns about loss of circulation, and you can feel each one as I pinch them. Very good. And I'm going to feel your pulse there, nice and strong and irregular, and a regular rate. And just comparing it to the other side because they can vary a little bit in quality and strength. Very good. Next, I'm just going to get you to hold out your hands for me. I'd love to put a bit of paper on them. Lovely. Alright, feel free to relax down your side. I'm just going to do a little palpation down both of your arms. Start on this side. Any discomfort or changes in strength in this arm? Very good. I'm just going to take your hand and flex your elbow and extend. And same, we're going to rotate your wrist. Make sure you've got full range of motion. No discomfort. Perfect. Do the same thing on this side. Muscles are feeling good. No discomfort. And no changes in strength on this side, right? Very good. So I'm just going to do the same thing. I'm going to extend that elbow and flex it. That feels okay. And I'm going to take that wrist and rotate that as well. I have a little bit of early arthritis in this wrist. Not uncomfortable from what I'm gathering, but just a little bit crunchy, and that's okay. I can certainly get you on some joint supplements to help for the future, okay? Very good. And coming back, I know we were feeling lymph nodes here. I'm also just going to hold on to your wrist and feel for pulses at both sites. Make sure that they're lining up the same here. Lovely, that's perfect. Now, if you don't mind, I'm just going to step around and just have a feel down your back. I'm going to do a couple tapping spots, okay? Let me know if you feel any discomfort. So, just feeling over your shoulders and down shoulder blades and your back. We're just going to do couple taps. Let me know if there's anywhere they're causing discomfort. Perfect. Everything's checking out very well. We're going to use the word body condition, not weight, because weight can very much vary. But your body condition looks good, so does your muscle condition. Your skin's looking nice and healthy all the way from top of your head to your hands here. Alright, I'm just going to do a couple reflex checks as well. So we'll be checking your elbows and your knees, okay? So again, I'm just going to come to the side here and just relax while I do a couple taps. That's perfect. And this side, I'm going to do excellent. Going down to this knee. Lovely. And this knee. Excellent. All right. So no concerns about any neurologic issues from my end. Do you have any dizziness or anything out of the ordinary that you want to ask about? Everything's been stable. Very good. Cardiovascularly, heart, and blood pressure, from what I can sense, everything seems to be checking out very well there too. Now I'm going to hone back in, looking more specifically at your eyes. So if you don't mind, I'm going to get you to close your eyes and then open them again. So close and open. Perfect. And close them for 2 seconds. Just hold them for right now, and when you open them, look right into the light, okay? Lovely. So, normal reflexes of your pupils to the light. I'm going to cover up one side here, and we will repeat that again. Very good. And covering up with this side. All right, lovely. I need you to follow move my finger. I know, just watching how your eyes contract. Here, I'm going to stand off to this side for this direction. Lovely, and going up and down. And then, I know, it's going to recheck your side to side here. Perfect. Alright, just look over my ear at this side. We'll have a very good look in your beautiful eyes. Nice whites of the eyes. Beautiful color. No abnormalities noted. Lovely. Alright, moving right along with our other senses. We did talk about hearing and ears already. Any concerns about sense of smell or sense of taste? Is everything as flavorful or scented as it always was? Very good, very good. And I guess my other question for you is your own sense of touch. When we're doing our finger pinch test, you could definitely feel that. Any concerns about loss of sensation from anywhere else in your body? Is everything seem to be acting the way that you expect it to and listening to you? Very good, everything's in tune. Lovely. Okay, let me see. I think just having a little glance at how you're breathing right now. Comfortable breathing in and out? Good. Any coughing, sore throat? I know it's kind of an iffy time to be getting any upper respiratory infections. All good. Very good. It looks like you've got good, comfortable breathing. It doesn't hurt anywhere. Good. Alright, strange, but moving along is our abdominal exam. So we kind of checked some things in the back, like a kidneys. We can check if there's any kidney pain with those taps on the back. But I'm just going to do a very gentle palpation along your abdomen. It can be a little difficult to fully relax, but do your best just to relax those abdominal muscles, that six pack there, so it can just feel a little bit deeper. And please let me know if there's any discomfort. You're doing a fantastic job. Excellent. Very well. Again, you are looking like a very healthy patient today. There's nothing jumping out from concerns from my end. Working our way through our systems here. I think you're checking everything off with aces. A+ all around. And just going to do a couple motion tests here with your arms. Very good. And with the legs too. Just gonna straighten and bend. Perfect. And again, last time over here. And here. Okay. Alright, well, for your natural exam today, without any more poking and prodding than I have already done, I'd say you are looking fit as a fiddle. Feel free to come back next time and we can do a bit more in depth if you like, okay? But this is a very, very good